I wanted to discuss some of the practical steps that healthcare systems can take to integrate these technologies effectively, to involve folks, to involve teams, to involve employees, and really stay ahead of the curve there when it comes to technology integration. And Dr. Garcia, wanted to start with you here to see what your thoughts are around technology integration.
Yeah, thank you, Lucas. And by the way, I love Monique's comments around culture and communication and engagement and connecting with your people. And Lucas, you spoke about this big puzzle, right? Well, no piece of technology is going to be effective without that big puzzle that is culture and engagement and all that. And for me, as a physician leader and as a president of a large medical group, that big puzzle is the journey of a clinician, right? From the moment they start their career to the moment they finish their career and think about retirement. And it just so happened that you have 3 generations in the workforce right now, and every generation has different styles, different approaches, different likes to the same topic and the same problem. So you almost have to map that journey of a clinician to be able to support them with those different pieces of the puzzle that you're talking about. Now, one of those pieces is how can you use technology for that, right? And let me tell you, in my prior organization, a large integrated rural healthcare system where I was leading 3,000 clinicians, we ask ourselves that leading indicator question. What can we do to use technology to predict? So we actually created an AI tool where we could predict with 18 months in advance, given on 500 fitting factors, of which 75 of them were relevant. We could predict which clinician could potentially leave that organization with about a year and a half in advance. Now, the question is what next, right? What do you next, and how do you engage them in a sensitive and professional way to be able to change that? But there is no question that AI and cybersecurity are taking the center stage as key organizational priorities. And let me just give you a few examples in which we are using technology in healthcare from the clinician standpoint. You've heard from your doctor and you as a patient. We have taken away that personal interaction, the face-to-face interaction, because we are relying on the computer, on the documentation. So if you ask any of your physicians right now, they'll tell you that part of the reason why burnout happens is because now we're too concentrated in the computer side and not on the patient side. So ambient listening for patient charting is one of the tools that we're using right now, and it's becoming the gold standard, where you actually can have a conversation with your patient, and then the computer is registering the conversation and creating the note for you. So you can then have that meaningful interaction with your patients. AI can also improve patient care. For example, endocrinology, diabetes control. One of my good friends from medical school is an endocrinologist and tells me, Luis, you know what? Right now, my patients don't need me. We have smart insulin pumps that at any given time can know where your blood glucose is, whether you ate, didn't eat, took breakfast or not, any given time of the day, and they can automatically adjust the amount of insulin that you need. Now, the patient still need that relationship with the physician, but that's an example in which we can improve patient care with AI.